Welcome to vpod.ai.
Great to be here.
This deep dive is sponsored by StoneFly. They're your trusted solution provider and advisor for, well, a whole range of things: enterprise storage, backup, disaster recovery.
Right. Hyper-converged solutions for VMware, Hyper-V, Proxmox clusters.
Exactly. AI servers, the SA355 turnkey security appliance, public and private cloud stuff, too. You can find out more at StoneFly.com.
Definitely worth checking out.
So today, we're diving into something that affects more people than you might think, often pretty quietly. It's hyperhidrosis.
Which is basically excessive sweating.
Yeah, and we're not just talking about, getting a bit warm on a hot day. This is what can be sweating so much your clothes get soaked, or it's literally dripping from your hands.
It's quite intense for those who experience it.
Absolutely. And for you listening in, someone who likes to get informed quickly and thoroughly, looking into hyperhidrosis really sheds light on a surprisingly common issue that goes way beyond just normal body temperature stuff.
Okay, so maybe picture this. Imagine your body's internal air conditioning is just stuck on high.
Even when it's not hot out.
Exactly. Even when you haven't been exercising. That's kind of the core of hyperhidrosis. It's sweating far, far more than your body actually needs to cool down.
Now.
And the thing is, it's not just like a minor inconvenience. It can really disrupt someone's day-to-day life, causes real social anxiety, embarrassment. It's significant.
Yeah, I can see that. And it's not always like everywhere on the body, right?
Mm-hmm.
Often it focuses on specific spots.
That's right. Very often it targets places like the hands, the feet, underarms, sometimes the face. Mm-hmm. And what's interesting is this kind of focused sweating usually pops up at least once a week, typically while you're awake, and it tends to be symmetrical.
Symmetrical.
Meaning if one hand is affected, the other one usually is too. Same for feet or underarms, both sides.
Ah, okay. That's a key detail.
Yes, that bilateral presentation affecting both sides is often a hallmark, particularly of what we call primary hyperhidrosis. We'll probably get more into that distinction later. Right. But maybe before we dive into the why it happens, it's really crucial to talk about when excessive sweating could actually be, a warning sign, something more serious.
Absolutely. Critical point.
Yeah.
While we're focusing on hyperhidrosis itself, those red flags are vital.
Mm-hmm.
The information is clear. If you have heavy sweating, plus things like dizziness or chest pain.
And that includes pain that might sort of radiate out to the throat, jaw, arms, shoulders.
Exactly that.
Mm-hmm.
Or if your skin feels cold and clammy and your pulse is racing, those are absolutely reasons to get immediate medical help.
Definitely. Those aren't typical hyperhidrosis symptoms on their own and could point to something else entirely, maybe cardiovascular. You need to rule that out fast.
Right. And beyond those, like emergency signs, there are other times to definitely check in with a doctor.
Right. Oh, for sure. If the sweating is really starting to interfere with your daily routine, making things difficult.
Or causing emotional distress, maybe making you withdraw socially.
Precisely. Or if you suddenly start sweating way more than you used to, seemingly out of the blue. Or another big one is experiencing unexplained night sweats. Those are all good reasons to have a chat with your healthcare provider.
Makes total sense. Because, sweating is normal, right?
Yeah.
It's just our body cooling itself down.
It's our natural AC, yeah.
The nervous system tells the sweat glands to kick in when our temperature goes up. But the information also mentions that nerves can trigger sweating just from being nervous, especially on the palms.
Yes, that's the stress response kicking in. So you've got temperature regulation and you've got emotional or stress triggers too, different pathways leading to sweat.
Okay. And delving a bit deeper, there are different kinds of sweat glands involved.
Exactly. We mainly talk about two types, acrin and apocrine glands.
Acrin and apocrine. Okay.
The acrin glands are, they're pretty much everywhere, all over the body. They open directly onto the skin surface. And here's the key thing for our chat today. Acrin glands are the main ones involved in hyperhidrosis.
Got it. Acrin, main players. What about the other ones? Apocrine.
Yeah.
They're more in specific areas.
Yeah. Apocrine glands tend to open into hair follicles. So you find them mostly where you have lots of hair follicles. Think scalp, armpits, the groin area.
Right.
Now, they might play some role in hyperhidrosis too, especially maybe in the underarms, but their primary role isn't as directly linked as the acrin glands. Apocrine sweat is also chemically a bit different, which is why it can sometimes be associated with body odor when bacteria break it down.
Okay, that helps clarify the distinction. Now, you mentioned primary hyperhidrosis earlier. The sources talk about primary versus secondary. That sounds like a really important difference.
It's fundamental, really. Primary hyperhidrosis is basically, the excessive sweating is the condition. It's not caused by something else.
So the sweating itself is a problem.
Pretty much. It's thought to happen because of faulty nerve signals. Like
Yeah.
the nerves are telling the eccrine sweat glands to work overtime even when they don't need to.
Oh.
And as we said, it often hits those specific spots: palms, soles, underarms, face. And crucially, with primary hyperhidrosis, there's no underlying medical reason we can point to,
Yeah.
but there's often a family link. It can run in families.
Interesting. So a genetic component, maybe.
Seems likely, yeah, some kind of predisposition.
Okay, so primary is like the body's sweat control is just overactive in places for no other known reason. What about secondary then? That name implies it's secondary to something else.
Exactly right. Secondary hyperhidrosis means the excessive sweating is happening because of something else. It could be an underlying medical condition, or sometimes it's a side effect of certain medications.
Like which ones?
Well, the sources mention things like some types of pain relievers, certain antidepressants, even some medications used for diabetes or hormone issues.
Mm-hmm.
And a key difference here often is that secondary hyperhidrosis might cause sweating all over the body, not just in those specific zones like primary often does.
That makes sense. If it's tied to a systemic issue or a drug, it might affect the whole system.
Right. And some of those underlying conditions mentioned include things like diabetes, menopause, hot flashes, thyroid problems, even some types of cancer, nervous system disorders, infections too. It's quite a list.
Wow, yeah. That really drives home why it's so important to get checked out if you have unusual or sudden excessive sweating. You need to know if it's secondary.
Absolutely. Because if it is secondary, then treating that underlying condition or maybe adjusting a medication if possible could actually resolve the sweating problem itself.
Right, treat the cause, not just the symptom. So, besides family history for primary, what other things make someone more likely to develop hyperhidrosis?
Well, having that blood relative with heavy sweating is definitely a big risk factor for primary. For secondary, as we discussed, taking medications or supplements known to cause sweating is a risk. And obviously, having one of those medical conditions that can trigger excessive sweating puts you at higher risk for the secondary type.
And are there complications besides the, discomfort and awkwardness?
Yes, unfortunately. That constant moisture on the skin isn't great. It can increase the risk of certain skin infections.
Ah, right. Like fungal infections or something.
Could be, yeah. Bacterial ones, too. But beyond the physical skin issues, the social and emotional toll can be really significant.
I can imagine.
Constantly worrying about clammy hands or sweat showing through clothes. It can lead to a lot of embarrassment, self-consciousness. The sources even mention it impacting people's work or education choices.
That's really rough. It shows it's definitely not just sweating a bit more.
Not at all. It's a medical condition with real quality of life impacts.
So given all that, what do treatments look like? Where do doctors usually start?
Often the first line of defense is antiperspirants. Not just the regular kind, but often prescription strength ones.
Have those work differently?
They typically contain higher concentrations of aluminum compounds that physically plug the sweat ducts, reducing the amount of sweat that reaches the skin surface.
Okay, and if those aren't enough?
Then healthcare providers might look at other things. There are certain medications, sometimes topical, sometimes oral, that can help reduce sweating systemically or locally. There are also therapies like antiperspirants.
Antiperspirants, what's that?
It's a procedure usually for hands and feet, where you immerse them in water and a mild electrical current is passed through it. It's thought to temporarily block the sweat glands. Needs regular sessions, though.
Interesting. And I think the information mentions surgery in some cases?
Yes. For severe, persistent cases where other treatments haven't worked, surgery is an option. This could involve actually removing some sweat glands, particularly in the underarms, or a more complex procedure involves interrupting the nerve signals that trigger the sweating. That's usually a last resort, though.
Right, because nerve surgery sounds pretty serious.
It carries potential risks and side effects, absolutely. And of course, going back to secondary hyperhidrosis, if there is an underlying cause, treating that condition is really the primary goal. That might resolve the sweating on its own.
So it really sounds like a step-by-step process. Figure out if it's primary or secondary, try less invasive things first, and consider more involved options only if necessary.
That's generally the approach, yes. Tailored to the individual situation, the severity, and the type of hyperhidrosis.
Okay. So, as you can clearly see, hyperhidrosis is really much more complex than just, sweating. It's a condition with different potential causes, and it can have some pretty real impacts on daily life.
Definitely. And understanding that difference between primary and secondary and knowing those red flags for when to seek medical advice, those are probably the most crucial takeaways for you.
Yeah. This whole discussion really highlights how something we think of as simple, like sweating, actually involves some intricate body mechanics and can significantly affect well-being. Hopefully this deep dive gave you a clearer picture of hyperhidrosis.
We hope so.
And speaking of things that are reliable and robust,
Yeah.
if you're thinking about protecting your valuable data, you should really take a look at StoneFly.
They have some seriously solid solutions.
They really do, including a great option for immutable and air-gapped storage, storage that can't be altered and is physically disconnected from the network for ultimate security.
That's crucial these days.
Absolutely. For instance, they're offering a 100 terabyte immutable and air-gapped SSO NAS right now for $8,995. That's a powerful way to secure your critical information.
Sounds like a very competitive offer for that level of security and capacity.
It really does. You can find out more about that and all their other solutions over at StoneFly.com.
Definitely worth investigating if data security is on your mind.
For sure. And on that note, that brings us to the end of this deep dive. Thanks so much for tuning in.
Thanks, everyone.